door momentarily. I want to open the mic because our office is not all here. Ty, Maddie, Erica, Ethan's here. Some others, Ethan. We've been getting inundated with messages, and I know the same is true for Chandra, of patients who are waiting for surgery. So I just want to take a moment. Don't mean to put anybody on the spot, but if you're inspired to share about how you're anxious about this moment, now's your moment. And I can come to you. Come on up.
I'm with the Ottawa Health Coalition. One thing, I had to wait 16 hours this summer for care at the Mofor Hospital. And literally, when I was better, finally better, lucky, like thank goodness to all the care staff there, I wanted to go back and create a team of people that would bring blankets and help the people waiting for days, for care, kind of thing. Literally, we were almost lying on the ground outside at the Mofor Hospital. That's where the line was. Like, this is, I suggest it's becoming an urgent situation, just like a flood, just like a fire. And we have to think, what can we do to help patients now? And we're also lobbying for the future and whatever we're going to do as action. But really, for-profit care is not this wonderful thing that Ford and his buddies want to tell you it is. We know, like, for instance, there are studies in the States, dialysis, for-profit dialysis, people die more often in that kind of care. Like, we have the research that it's not high quality. So we need a public system that's high quality care, funded properly, delivered publicly by unionized workers.
Quick call out. Yeah, come on up here.
My name's James Slater. I don't have a health story to share. I used to be a population health researcher. The universality and accessibility and equality of our healthcare system is one of the most cherished values across all political spectrums, all social classes, and all. It's not asking for a handout or a gift or a favor or something free and publicly funded healthcare. It is asking for the government to spend our money on our healthcare.
Well, James, that's a really good segue about handouts, because we brought with us something that wasn't in the Premier's announcement on Monday. This over here is a gift to us from Velvet LeClaire, one of our city's unbelievable artists who does a lot of work in politics in our city. And through this piece of art, Velvet wanted us to understand that Doug Ford is actually an ATM. Doug Ford is the most transactional premier in Ontario history. You'll notice here, if you come up and look at it, and this ATM, we hope, will be replicated in communities across Ontario. There's a button you can press to destroy the Greenbelt. There's a button you can press for healthcare privatization. There's a button you can press for Bill 124, but you know what? There's a button on this ATM that doesn't work anymore. And it's the one Chandra was talking about. It's the one for Bill 28. So as we do this tour that Adrian's going to take us on in a moment, I want you to remember that QP education workers stood up for their working conditions, but stood up for all of us. And we stood up with them, and Chandra, absolutely, and we can do the same for healthcare. Okay, we can do the same for healthcare. We're going to pass over to Adrian, but in case folks have to leave her, I want to put something on your radar. February 3rd, Chandra and I are going to be having a roundtable with healthcare leaders in our city that will be opened up on Zoom. You can tune in. And there is organizing going on in this province, lots of organizing that is going to be just as militant, just as forceful, just as firm as those amazing QP education workers were. Right? Over to you, Adrian. Let's go on our tour.
Yeah. All right. 3, 2,
1. This is probably one of the most Canadian peaceful protests I've ever seen.
Perfect. Hi, everyone. So, right across the street, 115 ExecHealth on the fourth floor is a private clinic that's operating here in downtown Ottawa. Yay! Shame? Yay! I'm going to tell you a little bit about what we've been able to collect information from. Some of it comes from their website. Some of it comes from phone calls that people have made. Credit to the Ottawa Health Coalition for doing a lot of this work. Thank you so much. And then we also rely on the incredible studies done by the Ottawa Health Coalition in 2016, where they called 130 private clinics across the country, posing as patients, asking them about the charges that they were going to pay, asking them about, asking other people who were working there about what was really happening behind those doors. And so we've got all of that information to share with you, and it's really thanks to the health coalitions across the country for gathering all of that information. So let me tell you a little bit about this one. This clinic is a boutique clinic, is what they call themselves, and they offer a medical concierge service. So same day or next day, they say unhurried appointments. It's because they have really, really low ratios of patients to doctors. And we've seen lots of private clinics who say they have 500, 400 patients per doctor. In the public system, it's 2,000, it's 1,500. So we know when we take public doctors out of the public system and we put them in private clinics, we severely limit the number of patients that they see. And it causes, of course, the doctor shortage that I'm sure many of you are here they're able to expedite, they claim on their site, they're very pleased to say that they can expedite surgeries, MRIs, and specialist referrals through what they call private channels. And they say that they do that especially when public wait times are too long, which means when they've decided that public wait times aren't too long, they just help people jump the queue. So you can go here, you can get it, and then you can jump ahead of everybody else who's been waiting longer than you, who may need it more than you. The fee for this service is $2,000. Sorry, I got to change page.
Do they get to jump the queue for operations too then, because they got their studies?
If they have their information first and they get on the list first, then yeah, absolutely.
Okay, shame. For operations too.
Watch out for cars.
Okay. As of August, there were already 160 people on the wait list to join this clinic. Oh, thank you. Private MRI clinics in Ontario have admitted in the past to accept patients who pay out of pocket for unnecessary services. These people do not have doctor's referrals. They do not need to get scans. But if they pay out of pocket, the private MRI clinics will give it to them anyway. And when they do that, when you scan anybody, when you spend 5 hours getting a physical, there will always be things that show up as abnormalities. And then those will be referred back to the public system, where they will go through extensive testing and additional procedures that can be totally unnecessary, causing backlogs for everybody else. The reported cost to get unnecessary medical scans written without any referral is $700 to $1,200. But remember that it also creates these false positives that cost the public healthcare system so much more money and time and resources. CT scans, which you can also get done unnecessarily by paying out of pocket, expose patients to high levels of radiation, much higher than X-rays, and then have long-term health exposures. The Ontario Hospital Association has reported that private MRI clinics take the easiest scans. They cherry-pick the patients. They do not have the resources to take on complicated patients. They do not have the resources to take on high-risk patients. They take the easiest, they cream skim off the top, and they leave the public system that is now under-resourced with the hardest people to make sure that they're taken care of. So private clinics like these are causing our longer wait times, and we're going to see a massive proliferation of them if we let Ford get away with this plan. We are going to move along to B. It's the second location, and it's just down on Slater, so we're going this way.
Okay.
All right, we're headed to Slater. what is that guy at the microphone doing? We are here because we're here to talk about the growth of private health care. Keep moving this way, folks. Keep moving this way if you can. Adrian, throw to you.
All right, hi everyone. People can get by us. As Joel just said, those who don't know why we're here because this is home of La Vie, which is another private clinic here in Ottawa. It's a private healthcare clinic. Like the others, they're a boutique clinic, which means they co-make all our public healthcare services with private services, so they don't charge people out of pocket. La Vie actually already has 2 locations in Ottawa. They have a location here, and they have a location in right by a hotel. We don't know if they're going to look at doing overnight accommodations, but it's possible. You know, that would be, I'll let this rectify. Other private clinics, really well-known ones like Schuldeis, where they do hip and knee replacement surgeries, and then the service itself is paid for with OHIP, just like that Ford promises, except they also recommend that you have to stay for 3 nights. That accommodation is out of your pocket. You have to go the night before your surgery, you have to stay for 2 nights afterwards, you have to pay for your accommodations there, for their additional services, for the food, everything has to come out of your pocket. This is not a free service, this is not paid for by public health care, this is not just OHIP coverage, it's so much more out of your pocket. From this phone call that we had about if we could be a patient here, this is what we learned. If we were here to have we have to come here for a 5-hour physical, it's required. 5-hour physical. That would cost $3,000. If we need to get a breast exam, it would be $2,000. If you don't have a membership, which is at the cost of $225 a month just to remain a member, then you would need to pay for their case management system to help, as they describe, patient navigation. That comes at $2,000. Our interviewer was told that this was a solution to the doctor shortage. I guarantee you, this is no solution to the doctor shortage. This will absolutely increase the doctor shortage that we're already experiencing. As we know, a 5-hour physical is likely going to result in more questions than in answers and create more backlog in our public health care system. One of the clinics that we weren't able to view today in the downtown core is cataract clinics. And I want to talk briefly about them because they're a good example of how extra fees get charged even if the service is paid for publicly. And so in this case, when we call cataract clinics across the country, we found that they were charging people for having foldable cataract lenses. So you go in and they would tell you what you really need is this additional lens, not the lens that we give you for free that's paid for with your medical service. You need to be upgraded to this other kind of lens. And it's $400 just to get that lens. And so people are put in this very vulnerable position where they have to tell this person who's going to perform surgery on them that they don't want to pay the extra cost. And it's really intimidating for patients. And so we see these clinics time and time again having hidden fees, claiming that everything is free until you get in there, having all kinds of additional membership fees, and then putting people in very vulnerable positions where they're asking their surgeon not to charge them for things they can't pay for, but they're just paying for it and trying to find other ways to make rent and pay for food. Oh my gosh, sorry. There is ice falling. Please be careful. We're going to head back to Confederation Park. So thank you for being here. Thank you for learning about a couple of the clinics here. This is not all of them. There are many throughout Ottawa. There's many different locations as well. They're already here. They're already charging patients. We have tons of information about it already, and we're gathering more. So this is absolutely a warning call. We can't let this happen. We have to keep fighting back. Please continue to write. We've got 2 amazing MPPs here today. Let them know that. And I've already heard from some of you in this crowd who have told you that you've had private patient services, private patients, you your own advocates because healthcare workers are so overburdened already. So we need to find solutions, and there are tons of solutions out there already. We need to resource them, and we need to make sure that we don't allow privatization to continue. So thanks for coming. We're going to head back. We'll just head straight down Slater. Thank you.
neighbor Adrian taking us on that tour. Thank you, Adrian! It's always nice to know who's in your neighborhood, isn't it?
Yes.
All right, so I just want to pass the mic momentarily to neighbors going to play us a song. But as we do that, put a couple things on your radar again, okay? February 3rd, remember that date? Chandra and I are hosting a roundtable with healthcare leaders. We're going to put that up on the Zoom or that digital stuff I don't understand, so you can tune in. But there's going to be a lot more organizing. Ed? Is there anything else you want folks to know from the Health Coalition's perspective locally? Good. Nancy, I see you too from the Health Coalition. Thank you so much.
Thank you.
For being here. Thank you. Let's give a round of applause to the Ottawa Health Coalition. Okay. So, if you haven't signed the petition yet, they're over here on this map of the city thing. Let's throw it over for a musical ending to a wonderful day, and thank you so much for coming out.
Thank you.
I'm not going to take my guitar out. I just learned it. I just wrote this song yesterday, so it needs some work. But if you all help me out, we'll give it a try here. Okay.
Okay, you can share.
Oh, Dougie, what have you done? You made it through COVID, but what about the nursing homes that we run? You said $1 a beer. You swallowed a bee, you dodged the truckers, but now we see it's just old stock Canadian. You do what you want to do. You don't care what people think of you. You lean into the power, you think we'll fall in line. Building your little empire with your friends and developers in mind. Oh, Dougie, what have you done? You're after our health care. We want it public, you want it privately run. And how about the mayor?
Just the guys.
Let's give them more sway.
Thanks.
We won't let the people or the councillors get in your way. That's just old stock Canadian. You do what you want to do. You seem to forget who elected you. You lean into the power. You think that people will fall in line. Building your empire, friends and developers in mind. Oh, Dougie, there's so much to say. From the green belt to the wetlands, those places just get in your way. But for us ordinary Ontarians, those places are dear. We won't let them go. And we want you to hear, we're not old stock Canadians. We care in what we do. Our actions inclusive, respectful, and true. It's not about the power. We want a world that will survive. Keeping 7 generations to come in mind. Oh, Dougie.
Well done. Okay, actually, one last thing before we leave. I had the great, wonderful opportunity to talk to David, who spoke to me about something he's struggling with in healthcare, and asked him if he's willing to share it with all of us. David said yes. Over to you, David.
Okay, is this working?
Yeah.
I want to share my story with the healthcare system and what this really means and what these kind of policies really mean for everybody and everybody's loved ones. So in December, actually since June, I was struggling with an unknown medical problem, which is now diagnosed. In December, I went to the hospital 3 times because I started losing feeling in my hands, in my feet, and my face. And basically, I needed an MRI. I went to the hospital, and I was told that I could not get an MRI unless I came back and I was paralyzed from the waist down. I waited 2 weeks to see a neurologist, but I was told that the wait time for an MRI could be a lot longer. And I opted to pay $4,000 for a brain and spinal MRI, which was key in getting a diagnosis and medication. But when you sabotage public health care by a policy of deliberate neglect, you're paving the way for people to fall through the cracks, to have premature death, and to lose their loved ones, or for healthcare workers and any number of people to have a complete mental crisis. And I am lucky enough to have gotten this treatment, but there will be many who don't. Yeah. And this is why we're here.
Yeah. Thank you.
All right, thank you folks for coming out. Thank you to everybody who spoke.
Thank you.
All right, keep in the loop, okay? Are we gonna get Doug Ford on the run? Yeah. Are we gonna get Doug Ford on the run? Yeah. All right, thank you so much for tuning out. Let's keep causing trouble, okay?
Christophe Elie, I'm a political folk singer, and I'm concerned about healthcare being privatized in Ontario. We've got to stop Doug Ford. You can find me at chriselie.com.
Awesome.
Yeah.
Thanks for coming out. Cheers.